Afternoon, everybody. So, iPad activate. So I have known Dan for a very long time. I've just gotten to know Kerry, but we've known the foundation for a very long time. This is the corporation that was our inaugural funder. After we got public sector resources, it was Bank of America who was there within a matter of practically days with resources for us to launch our program in Pennsylvania in 2004 and 5. So it's appropriate that if we want to talk about a private sector leverage and private sector involvement in mission-related activities like food access, that we turned to Bank of America. Also because they'll have interesting perspectives as the field has changed and as the field has broadened over time, and we'll be able to talk about that. So I'm going to start with a question for Dan. You were there back in 2004. There are no photos, but there is evidence. And at that time, we were improvising as a CDFI. We were creating our first fresh food financing program. Can you talk to us about those early years of innovation and how, from within your banker shoes, you look at community financing innovations as they happen in the field and how you took to our ideas?
Sure. So it is hard to believe it's 2004, 2005. Feels like we just completed the negotiations on the credit facility. So back in 2004, 2005, Bank of America, you came to Bank of America with the structure, the idea, the proposal, and the outline of it. And first, the foundation was the first to step up with a $500,000 grant to provide the first resources. And then out of that, the Bank of America bank provided $5 million program-related investment to the core fund, and then the Merrill Lynch folks provided $5 million to the multi-bank credit facility. So $500,000 and $10 million to what was really then an idea or really pre-proof of concept. Right. And that was a lot for us, $10 million and $500,000 in grants for proof of concept. And really it was done because of you, because of the reinvestment fund. You were the right organization in the right place at the right time. Without you, that wouldn't have happened. You have to realize that when the bankers looked at the financing for fresh food markets, it was not easy. I mean, we just looked at it and shook a little bit. First, you have to realize most of these businesses are cash-intensive businesses. You look at their audited financial statements, and there's no profits reported there. Now, if you get the register tapes and you follow cash flow, you realize that they have the ability to repay debt. But if you're just a banker and you rely on only audited financials, you look and say, how do I make a loan to this? That's one. Second, the type of financing that was needed or that was being requested was working capital or leasehold improvements. Right? And bankers love hard real estate, dirt, and buildings that you're secured by, and none of that was really what was going to work for the markets that they were coming to. And lastly, the aspects of this type of financing is fundamentally different than the vast majority of community development financing that we either do in community development or even that CDFIs do. I mean, the vast majority of community development financing at its core is the pre-funding of government payments. Right? You think of it in terms of affordable rental housing, which is the vast majority of what we're doing. You're building buildings, you're being repaid on your loan from the rent, but the rent comes from market rents, are much higher than what residents can afford. The payments really come from public sector, the government, in either the form of low-income housing tax credits or Section 8 vouchers or the like. In the charter school business, you make a loan to build the housing. The payments for that loan come from the public sector, not from the students themselves. When you look at primary health care facilities, again, you build the building, the revenue stream comes from the public sector. That's what we do, and it's very important, very needed, and is critically needed by communities. This is business financing, a whole different level of risk. It's you build it and look for the revenue coming from the government. No, the revenue comes from operating a successful food store with lots of competitors around you. That business lending is fundamentally more difficult. And the bank looks and says, I really can't do that on a direct basis. And the reinvestment fund says, I think we can make this work. Now, we did it with you in the reinvestment fund because, one, you're really smart, 2, you have a really strong balance sheet, and 3, you have a long track record of success. And it was that smarts, the strength of the balance sheet and the success that we said, we're betting on you. I mean, to be quite honest, we liked the idea, but could not get comfortable with the underwriting and the end loans, which is why only a CDFI could have made this thing happen. We were happy to be the investor, but the investor in you.
Mm-hmm. And then subsequently, this field has broadened, and you have invested in many CDFIs that are doing food work, perhaps in a general sense, just financing them for all that they do, but sometimes involved in their specific programs or their growth around having a new product.
Mm-hmm. So I would still say, though, that this is one of the more challenging sectors for the typical community development organization to finance. So many CDFIs still look and say, okay, so it's kind of like our housing work, right? So if, I'll put it in the housing fund. It's really a facility. It's like our charter schools, and we'll underwrite them like our charter schools and build it. It's kind of like our small business portfolio. We have a whole bunch of micro loans, and we'll put it there. And this is a portfolio that challenges CDFIs to think differently in the size and scope. When we look at supporting the CDFIs that do it, we look for the same things: organizations that are smart, organizations that have strong balance sheet, and that have a track record of success. They do have some proven models that they can learn from. So we're more comfortable with organizations doing that, but the fundamental features are still the same. The last component, though, that is so much different now than where you were in 2004, 2005, is the support from the federal government and the CDFI fund. I mean, the Healthy Foods Financing Initiative was a game changer. It provided the subsidy to make this business work. I mean, bottom line, the magic of CDFIs to some extent is that they are a place in which you can combine subsidy and capital and do things that the private sector can't do on a direct basis. Without the Healthy Food Finance Initiative providing that subsidy source, there'd be a lot of capital left on the sidelines.
Yeah. Or building the balance sheets of those loan funds by retaining it and then lending it. Yeah.
Right.
So, Kerry, you lead a foundation that has a number of funding priorities. Can you talk to us about how food access fits into the gamut of what you're trying to affect?
Sure. And I think probably the best way to start, even though we were part of the 2004 deal, is really I think the inflection point for us in the foundation was the economic downturn. So 2008 arrived, and that's when I really began my job in the foundation. So, and quite frankly, the housing market was falling apart, and low-income communities and middle-income communities were feeling a lot of pain. And what we saw, quite frankly, as a funder of organizations in the community, that hunger was just rising. The usage of food pantries, food banks was just crazy. It was off the charts. I think at the high point there was some 57 million Americans living with food insecurity. It's gotten a little better this in 2016, but it's still a huge issue. 17 million were children, and working poor were accessing food banks. So it was no longer, the face of hunger had changed. It was no longer individuals who were homeless that were accessing food pantries. So one of the things that we did from the foundation was really reframed the work that we were doing in communities, and really looked at community development writ large as the issues around putting food on the table, looking for affordable housing options, and perhaps equally as important, if not more important, connecting people to the workforce. So many people were underemployed, and things were spiraling downward. So hunger, even though we're a financial institution, became a big part of the focus of our work. And people often ask, gee, isn't that a little odd for a financial institution to focus on hunger? And it actually isn't, because it is about fundamental issues. And that's really where we have focused our energies across the U.S. And quite frankly, even if you look across the globe today, hunger is still an issue. caused by different reasons, really largely by poverty and displacement. And I think since World War II, we have more people displaced around the globe. So hunger is a global issue, it's a national issue, and it's a local issue. And our response was local. So we did really focus in on that as a way to jumpstart economies, getting people on track. Fast forward to 2016, there are a lot of, unemployment looks better, things look better to some degree, but in communities that were low income to begin with, they're in a worse situation. So we've kind of kept our focus on these fundamental issues because we do think that it's critically important. And we're framing a lot of our work, whether it's looking at food insecurity, workforce, and housing, really around this issue of economic mobility. We need to bring opportunities to low-income communities and get things really moving. So it sounds like a basic elementary focus, but quite frankly, I think it resonates, and it has, quite frankly, been really the hallmark of our philanthropy since the downturn.
And you've helped us connect to a broader set of stakeholders and movements in seeing a connection between food insecurity and kind of food access in a classic retail sense, and helped fund us for some convenings in that regard.
That's correct.
What do you see as the gamut? Because you come at it from a hunger relief mission.
So it's interesting. We do come at it from a humanitarian, you need to feed hungry people, but quite frankly, we really have looked at this as an economic development opportunity. And I say that, at a community level, but also individually. So, for instance, during the economic downturn, food stamps were so underutilized. So we really brought to the fore and really helped connect food stamps in food banks and food pantries so people had access to them. So that was a big play. Quite frankly, if you look at even right here in D.C., which incidentally there's some 90,000 individuals living in food insecure households right here in the district, quite frankly, we've also looked at a lot of the opportunity within example of D.C. Catalyst Kitchens, really taking food, originally starting the mission as to feed the hungry, but it's turned now into more of an economic development opportunity with workforce development, social enterprise, et cetera. So we see food as a fundamental issue that all people need, but we're addressing a broader community development issue by focusing on it.
So Dan, can you talk about the range of financings, the different types of financings that B of A has brought to food access? It's not just financing CDFIs. I know that whether it's new markets tax credits, financing directly to grocers or developers.
Yeah, so where it fits, where the transactions fit within a community development mission or community development projects, we'll do each of those. One, we find that new markets tax credit and community development transactions are a good fit for this type, and Bank of America is one of the more active new markets tax credit investors. So good pool there. And then we do much of this out of our business lending component. But to do the kind of financing that is on the edge, where you're pushing the envelope, we still look to CDFIs to lead in that. Mm-hmm. And I would say that one of the areas that we need to do better, both at Bank of America and as an industry, is moving what CDFIs are doing on food store financing over into the mainstream. Right? If you look back to the example that of the charter schools, CDFIs taught bankers how to do loans to charter schools. I mean, I remember the first time transactions came in and we looked and said, okay, we have to finance a school over 20 years. And the charter is 3 years long, so revenue stream 3 years, debt 20 years. Nope, right, we're not going to do it. And CDFIs...
That's when the bassinet gets delivered to the CDFI's doorstep.
Yes.
You know.
And you really figured out, CDFIs in general, figured out a model that allowed you to remove the risk of the failure of the school and the ability to swap in a different school and a different operator, and demonstrated over time that this is actually a very good portfolio. Now bankers really like to do charter school loans. You've done that in other sectors as well. I think it is likely to happen in primary health care facilities as well. But in this field, we are lagging in that. So CDFIs continue to be the primary providers of what I would view as cutting edge or even classic food store financing, and the bankers still look at the issues around cash, around reporting, around the kind of financing that is needed, and still struggle there. And most of the transactions that are being done are really thought around, and the advocacy is around how we get CDFIs to do more of these transactions across the CDFI network. We're going to need to figure out how we can make some of the loans a standardized asset class so that the underwriting becomes more standardized in parts of it, not the whole field, but in parts of it, so that you can jump the financing over to the mainstream. Because if we just leave it in CDFIs, we will lose what we got in affordable housing, in charter schools, and other related areas, and we're still stuck in a place where the primary relationship is us providing capital to CDFIs, and then CDFIs doing loans to charter schools. And as much capital as you have and as much capital as you've grown to, that's not going to grow the sector. We're going to have to jump parts of this portfolio over to the banker side. I don't have the great answers on exactly how to do it. I'm kind of sitting here like I was in charter school going, 3-year charter, 20-year financing doesn't work.
The Patriot Act also got a little involved.
Right.
Cash-based businesses, cash checks, and there's a lot of cash moving around.
Yeah.
So that, I know, is what took Chase. Chase was a very innovative financer in New York City and the region for a while with grocers, and that's one of many reasons why they exited that space.
Right.
But leaving that to CDFIs to take on that niche.
Right. And we're growing together and seeing great successes in what CDFIs are doing and the growth. And you have, and TRF has been very good at spreading the both messaging and capability across the industry to other CDFIs. If we don't jump it back into banks, I refuse to sit here and just say it's a CDFI sector and it remains a CDFI sector. Otherwise, we're damning it to a subset of the amount of capital that needs to be for the industry.
Exactly. I think new markets has been well received. I mean, banks have taken exposure to grocery stores in a new markets context. Not so much in terms of the kind of corporate debt facilities that chains of stores need.
Yes.
Right? And what we've seen in our work is there's a break, and if the nationals who have direct access to Wall Street have really discovered underserved markets in the last few years, maybe the last 6 years. I mean, when we were working in Pennsylvania, we had no nationals. Couldn't get them to talk to us.
Right, I remember.
And now you see many new smaller footprints, new urban strategies, micro targets, food in every Walmart and every Target, lots of smaller town versions of larger grocery stores as a response from the Krogers and the others of the world that have now decided to respond to the inner city market. But the independents still lack the financing strength in that space, and that's been our niche. I don't know how to get that back to the bank. I regret how much of the charter school movement got back to the bank.
It's the right thing for the field.
Until it's not, and then it's back on the bassinet is filled with a baby again, and it's back on our doorstep. So food has not left our doorstep, and a number of state programs have popped up across the map. And I know, when speaking to Bank of America, one gets the opportunity to talk about banking anywhere, pretty much. I think the map is almost completely full, right? Hawaii, Alaska?
Pretty full, but we've got a few states.
Have you interacted with particular state programs, others, particular food initiatives elsewhere that you'd talk about?
Well, yes. I mean, I would say the hallmark is our local connection. And I have to tell you, before we even get to how we work with states, we've partnered with some national organizations like Feeding America. And I think that the piece that we bring to the table as a corporate funder is sort of illuminating the issue, quite frankly. We've worked with Feeding America now for 4 years. We run a campaign that leverages a lot of our social platforms called the Give a Meal campaign, where within a month's time we raise roughly $4.5 million to address hunger, and it gets filtered into the local food banks. So I think that the role that we've played from the foundation is one where we can use our voice, illuminate the issue, educate people about the issue. And we've done, I think, a good job at that over the years. Quite frankly, I think the other piece is, as you look locally, and as I mentioned, this is also a global issue, we've begun to work with the World Food Program. And I think here we've got some really interesting models that we're looking at it, and it's really addressing hunger as an asset-building program. I mean, solving hunger
equals asset building.
Yeah,
right.
and even the issue with the refugees. There's a lot of refugees that are settled in Jordan right now, and instead of bringing food in because they're hungry, they need to have food and sustenance, they're giving them cash cards, where they can buy food at the local grocer, and they're building the economy so that's almost like a welcome mat for the refugees as they move into Jordan. So the issue of food, to solve the issue, is not always to bring food. It's to provide economic support so people can buy food. And you're not displacing farmers, you're not displacing grocery stores. So there's just an amazing amount of thought in looking at food as the problem, but really it's the symptom of poverty or not access. And this whole idea of access is so critically important, whether you live in a rural community that doesn't have fresh food in a grocery store there. You need access to be able to purchase it. If you're poor or homeless, you need access to food. If you're a refugee, I mean, the access piece, I think, is the overriding word. But I do think as a corporation and as a financial institution, we've been pretty bold at taking this as a focus area. And quite frankly, if you think about all that we focus on in the foundation, it really is around poverty alleviation. And these issues are interrelated. So to solve these problems, you need to bring opportunity. So it's sort of circular in terms of what communities need, what individuals need, what families need.
Yeah. So I want to put a rubber band around something, because I don't want anybody to feel like we're talking too much about hunger. When one thinks of a food desert, and one tries to imagine the specific incidences of the consequences of a lack of food access, when that mom from her second job comes home and did not manage to take the extra bus on the route to get the food, and she's at home, hunger ensues. I mean, frankly, there is an overlap between, even with resources, a lack of access can lead to a hunger issue, right, because of the idea that it's not a local amenity, it's not a convenient resource, while also the fact that some of these neighborhoods in which we work, there is a lack of resources, which leads to hunger. And those fields then overlap. And one of the reasons we talk about this specifically is I want to encourage everybody who is interested in healthy, fresh food financing to not read a funder's website that says we're interested in hunger and not be able to make the case that you're relevant to it. That there, you see narrow pillars sometimes from funders and you don't see yourself in it. But you may be tangential to it, and there may be a case to be made. We were, in the early years, you funded fundees initiatives. That was easy. We presented an idea and got funded. Later on, the foundation had specific pillars, but you've made room for this idea that we don't have to be a direct center hit on food access. And I encourage folks to be creative about how you present your initiatives and be open to the idea of broadening your initiative if that's what gets you private sector relevancy, right? That thinking narrow can be a problem.
Good.
So I was not here in 2004, but I can imagine that's exactly what happened in the conversation in 2004. You connected it to a broader need.
Yep. Mm-hmm.
Yeah.
I mean, We did it in 2004 largely because you were a strong partner, made an argument for something, and we trusted in your smarts and your strength and your success. I think post-economic recession, what we're doing with it now comes from an understanding of a priority that we buy into,
right.
That it's both a hunger and nutrition case and argument and need, and second, an economic development one, because often the food store is an economic engine. It is a source of jobs. It is often the source or the symbol of economic stability that this community will continue and is ripe for potential investment. I mean, to some extent, we've talked with community advocates in the past around what a bank branch means in a community, about both access to services and a signal of investing. Now, over time, everything you can do in a bank branch, you now can do on the phone, but you're certainly not going to get your food through this piece. So the argument is absolutely still, in our view, that the food store can and is an economic anchor both for jobs and for a signal that there is stability here and a welcoming of additional investments, which is really what an economic anchor is. So that's the motivation for us doing it now, and then the question is, how do we do that through CDFIs, and how do we do that on a direct basis? And what we think a lot about is, how do we encourage the things need to happen to grow more of this, which we want to talk about.
Mm-hmm. So in this branching out, where there's at our core food retail and food access in a retail sense at the center, food hunger, food security to one side. To the other seems to be developing another niche, a channel, which is really around health. We've seen grocery stores become platforms for a number of different services, not just food retail. There was a day when bank branches were ensconced within stores. I think that was way oversold, and I don't think a lot of low-income people got access to banking through that strategy. It's mostly a suburban strategy. But increasingly we're seeing, going beyond the pharmacy model and seeing nurse practitioners in stores, seeing FQHC collaborations with grocery stores, where one business needs the traffic generated by the other, and the other benefits from this idea of kind of explaining the need for fresh foods, especially the produce aisle. And you can prescribe food, and then medical clients are moving through the grocery store and they might not think to go to the clinic, and they can be grabbed and educated or signed up or prescribed. And that there seems to be this broadening of the field so that there's a whole panoply of things which are food relevant and community relevant, but not just about a big box grocery store. We've seen a lot of alternative models in delivery, but also now starting to see multiple deliveries of things through the platform, which is your neighborhood store. Have you seen transactions like that, or have you seen parts of that tree take on multiple missions?
Well, I mean, I think you've hit the nail on the head that grocery stores, a sign of stability in the neighborhood, are also a way to signify that all is well in that community. There's stability, there's commerce that works. I think from the healthy standpoint, I was going to take it on a different realm, and it is the fact that if you have a chain grocery store, you have fresh fruits and vegetables. I mean, the issue, I think, in many communities is there's not a grocery store that provides healthy foods. Sure, they provide food, and there's all calories are not equal. I mean, and I think the whole issue of, you could talk about obesity. I mean, or diabetes, and it gets into health issues that you need to have a healthy diet to survive. And I think that access to food, and quite frankly, even food pantries struggle with the idea of bringing healthy food, not just calories, to survive. So I think as the food pantries have been much more sophisticated in logistics and bringing healthy food, so too are, I think, the opportunity to bring grocery stores, and so I think it's a health issue. And I go back to access, because when you look at community development issues, poor communities have less access to jobs, less access to food, less access to opportunities. This to me is the critical driver of our strategy. It's like, how do we bring all of this together so communities work? If you have to, I think you referenced transportation access is the other issue. If you've got to leave your job and take 5 buses to go to a grocery store because in your neighborhood there's just a corner store that sells prepackaged calories, you may not be home from your child, and it's a safety issue. So I guess my point of looking at this hunger issue and access to food in communities, rural and urban, is this idea that this is how people need to live. If you don't have access, you're off kilter, and people need to have lives that are to move ahead and be full and have jobs and progress. You need to have all those things working. So I think from a philanthropy or grant making point of view, it's our best investment. From your point of view, it's risky, but it works.
It's risky when you do it directly. When you have a good partner and a good CDFI, our track record is stellar.
Do folks have questions for us? Open the conversation, break down the fourth wall.
I'll start. I'll actually pick up on your last question as it relates to co-locating healthcare clinics and dietitians, community navigators in location. Is that something that you would look to fund for? Because I know John had asked the question, but I would like to hear more about that from the bank's perspective of funding those types of models.
So I'll jump in first here, and it will probably be relatively short. So, quite frankly, what you're describing also sounds like a settlement house, a community development center.
Models.
There's lots of different models. So, quite frankly, I know that there's clinics and grocery stores you can cash a check, but I do think that I don't think grocery stores are going to supplant multi-service agencies in neighborhoods that really are the heartbeat and are doing case management, working with families with multiple needs. So I just point that out. I don't think that the panacea of all community problems. But I do think, and I can say, the competition with like a CVS, they have nurses and practitioners on site, so you can get a prescription if you need penicillin, if you've got strep throat, and you can have those tests. So I do think we're now talking about convenience, and if you live in an upper class community, you have every convenience known to man. You can call someone; they'll bring you a meal. The dry cleaner will come to your house and pick it up. I think what you're seeing is this idea that our lives are complicated, and regardless of whether you're low income or middle income or wealthy, our lives are complicated. We are all looking for conveniences. So I would say in the grocery store piece that's. It sells. It works. It's a business model.
Just as food access, when it fails, equals hunger, in the same way, you can take convenience of service to the same place to get to the point of failure. So what we saw in Vineland, New Jersey, was a health clientele disconnected from medical services, uninformed that there are medical services available, and that the grocery store aisle became the place to inform, enroll, and then provide services, which then started a more virtuous cycle of then they know where the main clinic is because there was an accessory clinic in the store. That when access fails, something bad happens in these neighborhoods. This isn't just about it's less convenient to go get the flu shot. The flu shot never happens because the convenience bar was higher than your resources or your time allowed, and therefore you're less healthy.
First, Kerry, please go.
The only thing that I would say from your first statement, I think poverty plays a role here. Mm-hmm. Food access, there can be grocery stores and people have food stamps, but they can't meet all their expenses at the end of the month. They can't pay their rent. They can't provide for their family. So the issue of access also means in many cases that we need to have diverse access. So I put that. I don't think the grocery store is the only answer as you think about the multiple needs and issues families are facing.
Right, but as you add and bundle services in a co-located model and you're looking to finance it, just realize every service you add to it is going to have to cover itself from a revenue perspective, otherwise the financing doesn't work to it. And that revenue source can either be public sector revenue or a fee for service or a fee for revenue. I'd like all of it in a one-stop shop, but adding the service without the revenue that comes from it will eventually the transaction falls in on itself.
Anything else? Other questions?
This is probably more specific for you. Has there been any thought or traction on it? But look at the EB5.
Right.
Employment-based bid preference. Basically, it allows a foreign investor to put $500,000 for what they call targeted employment. I've tried to use it for quite a bit to no avail, and I didn't know if there was maybe any thought patterns to maybe getting CDFIs involved in helping decide what is invested in. Okay, these EB5 projects, so all this money goes in, it's supposed to be, in low-income areas, and it's ending up in Miami condos. And that doesn't, there's a lot of manipulation of the system, I'm sure you're aware, and it's probably a bigger discussion for policy, at a much higher level. But I was just wondering if there's been any thought about a way to try to get EB5 capital into these projects, because it's a really good fit. It's very cheap dollars. It's really designed to go into something like this. And it's programmed to fit.
Yeah, that's a long conversation, talking about the failure of economic development policy in America. So it has become captive to a set of players who both solicit the investments overseas, and that can be a sham, and that can be a predatory process. There are kiosks in Chinese malls selling green cards in America, essentially, with a commission-based system. They will finance your financing of the EB5 program. So it's, in some ways, it's a kind of upper middle class indentured servitude for immigration. It's gone wrong in a number of different ways. I do agree it's a great fit. We've co-lent with EB5 money in a number of larger projects. The challenge is EB5 money, not unlike new markets, does not arrive predictably to a project, so it usually needs a bridge just in case it's not there in time. I think that the reps and warranties that have been made to those investors has often been fraudulent around the structuring of the deal and the safety and soundness. There's a fiduciary duty to those investors that is often broken when you see a giant ski lodge in Vermont with no ability to repay. So I think it's a great tool, and I wish that program were more geared towards CDFIs, and I think we could do a great job. The challenge for us is, how on earth do you stretch yourself overseas? Because half of the transaction is done out of America, and then the end part of the transaction is done in America. We can do that part. I worry that the money is already tainted, twisted, misrepresented before it even gets to the States. So I don't know how you would do that from an international perspective. But there's a lot of public sector, quasi-public sector agencies who are authorities within the EB5 system, and we found that they're much better to work with. Our Industrial Development Corporation of Philadelphia is one of those centers, and the deals they do are great. So it's picking the players. Sejin?
You mentioned earlier government financing or government subsidies being part of a lot of the work that CDFIs do. I was wondering if, currently the food space, a lot of government funding and subsidies are coming from foundations, the government in terms of secure grant, and that might not be a sustainable kind of source into the future. Have you guys thought of what a sustainable subsidy source, if the sector does need subsidies, what a sustainable subsidy source would look like some kind of dedicated tax credit, like credit management, maybe? Just curious if you think we need one, and if we do, what would we do?
Sure. I'll take the start. First, I believe that the magic of what you see in this field magic word you see in a lot of places where CDFIs are, is made possible by mission-driven organizations sitting at the intersection of both subsidy and private capital. So I am a huge advocate for taking the position that subsidy is needed. If you just take the position that you want to finance things that the private sector can do on its own without subsidy sources, then you won't see the innovation or the creativity that we've seen. So one, I believe that in this field, particularly the healthy foods field, subsidy is critically important. It has been important. The field changed dramatically with HFFI, and it needs to continue. One, it can take the form of either grants through an organization like the CDFI fund on a dedicated basis or programmatic basis, or alternatively it can take the form of tax credits, although general tax credits are more defensible over the long term than special targeted programs for tax credits that tend to go away over time. So one, subsidies are critical for the continuation on this. If there is a legacy for HFI, it needs to continue. The subsidy must also be, and this is the really smart part in the CDFI fund, the subsidy must be provided at the institution level, not at the transaction level. So think of what is different between CDFIs and community development corporations, CDCs, and the strength and the health of those two organizations. In CDCs, we provided subsidy at the level of the transaction. We provided subsidies to build housing, and they built quality housing. If you want to build really good quality housing, you subsidize transactions. If you want to build a sector or a field that over time can finance good quality affordable housing, you subsidize at the institution level, which is what the CDFI fund did and why CDFIs are so remarkably successful. And you look at CDCs and they're struggling hand to mouth over time. So it needs to be at the institution level, whatever the subsidy source is, at the institution level, not at the transaction level. And third, I would argue that the subsidy must provide and encourage both for innovation and for scalability. If we're going to build this, you can't just prioritize giving subsidy to something that's new and that's different than what was done before, because otherwise we get lots of testing and fragmentation, but we never grow and we never scale this. And we're at a place where fresh food financing, I would suggest, is more an issue of scaling what we know works than trying to find lots of new things and test. We need both, but the subsidy must reward both innovation, but also must reward scalability. So that's on the subsidy side. Capital is almost as important. They are equally important in making this types of financing work. And the kind of capital that's needed when working with CDFIs here, and I'll encourage all my bank colleagues to provide, is it is not short-term capital, 3 years and less, and bankers love to provide CDFIs with money that's 1, 2, or 3 years. It's pretty easy. That's the easy part. But that's not the kind of financing that fresh food markets need. Nor is it the financing of a term that is the CDFI bond program out at 30 years. These are not real estate transactions. Both of that capital is available. What is needed in this field for CDFIs is I would describe as 5 to 10 year capital, which not all institutions provide. But if you're committed to making this kind of financing work, you've got to be providing capital in a 5 to 10 year window, which we do, and we encourage others to do. That's the kind of capital. So I think, yes, you need subsidy. Yes, you need capital that works. And if you provide both of those, then we have the ability to grow the CDFI sector in doing this. And then the last piece of it is what parts of the transactions can become a routinized, standardized asset class. So those kinds of transactions we might be able to jump across and have bankers do some of that transaction to grow. That's my policy encouragement pushing.
I think the small but growing proliferation of state and city programs is one source that they're taking this niche seriously and putting their own money behind it. And that was, it started in Pennsylvania, but then it quickly went national. And then we had to work really hard to get state programs up off the ground. But when you see states appropriate money, that's a kind of an acknowledgement that this is a very credible activity in low-income areas, and it is a niche within both community development and economic development that warrants resources. And they may not be earmarked resources. We may just be able to have food deals compete against that hotel project or that other retail project. I think new markets is not permanent, but longer extended than it's ever been before. And I think as deals become more replicable, they need a little less subsidy. Some of what we subsidize is actual risk and barriers, and some of what we subsidize is perceived risk and barriers. And as deals happen in certain geographies, the next deal's a little easier usually. It's easier to get more than one entrepreneur interested. We've seen that happen in Philly. We've seen it happen in Newark. There's begins to be marketplace acceptance, so that you might not need the grant and new markets. You may be able to just deal with new markets. And then I think it's really important for us all, and what you all should be doing tomorrow is telling people how important this resource is in these ad hoc appropriations we've gotten, but also getting it into the Farm Bill and getting it actually appropriated becomes the kind of sustainability that means that we're not tied to an administration or a first lady, that we're actually in something which doesn't share the same time frames as an administration. It kind of leaps across administrations, and make the case that this work, there's still much left to be done, as Michelle said in her note to us. It was read this morning. There's so much left to be done. There's so many markets we haven't touched yet. There's so many geographies we haven't gotten to yet, that getting that in there will be important. And then, of course, I think our rural work is incredibly important. I think our work has been slightly disproportionate to where there are mid-size and large CDFIs already, which tends to be metro areas, and not always rural areas. And that there's still a tremendously underserved market in rural towns. We saw that in the Honor Capital deal we did in Kansas. Gosh, if we could do 10 of those every 6 months, we'd have the money, and I think everybody would show up. The question is, are there enough entrepreneurs? Are there enough viable town sites? And is there enough equity capital to get those deals off the ground? We would love to spread that all over the country, and other models like that in smaller places. I think rural America has some years to catch up, and I would hate to see a program cease when it's been it's not quite been balanced around all places on the map. But I do think we have a chance at sustainability, if sustainability is recurring appropriations, because subsidies are never really sustainable. Somebody writes you a check, you don't earn it. I think we're through. We're going to have a little break and then a reception. We expect that Annie Donovan will be joining us at the reception, so please talk her up. Anything else? Gabby. Gabby.